Dear students, welcome to Bluepin Online. Shall we begin? Please use headset, pen and paper to take notes.
Here you go. Please let's know your feedback after class.
Now, today we'll go to the receptor potential. That is, it's also called as the generator potential. Hello?
Yes, yes, ma'am.
It generates an action potential in the sensory nerve is associated. Okay.
Yes, ma'am.
Now then next comes the definition of a receptor potential. It is defined as a change of potential in the receptor membrane due to a stimulus which may generate an impulse in the related sensory nerve. Simple one. Okay. Since it is a definition, we have to write it like this. That's all. Okay. It is defined as a change of potential in the receptor membrane due to a stimulus which may generate an impulse in the related sensory nerve. Okay.
Yes. Yes, ma'am.
Okay. Now, mechanism of development of a receptor potential is different in different receptors. Okay. It depends on different receptors. Okay. Now, here we are already seen that the Pacinian corpuscle is the best one to study the functions of a receptor. Okay. So, here we are studying the receptor potential, taking Pacinian corpuscle as an example.
Yes, ma'am.
Now here we have already studied the transmission, that is potential produced due to a distortion of the nerve ending due to application of pressure. No, first it has to be stimulated, isn't it? So distortion means a change from the normal position or from the normal form. Okay, so when this potential is usually formed when there occurs a change from the normal form of the nerve ending or the receptor. Since it is a Pacinian corpuscle, it will be the nerve ending. Okay.
Yes.
So when there occurs a change in this nerve ending due to application, here it is a pressure receptor. So due to application of a pressure, there occurs a change or a distortion, and this distortion is the one that is causing the increased sodium permeability. Okay. Okay. Now this sodium now enters the nerve ending and carry the membrane potential towards depolarization. Okay.
Yes.
It is all the same, but it's a slight difference. That's all. Okay.
Yes.
So here it will carry the membrane potential towards depolarization. Now that is known as a receptor potential.
Yes.
Okay. That depolarized membrane or that membrane potential is known as receptor potential.
Yes.
Okay. Now this potential change now forms a current sink which produce an action potential in the first node of Ranvier. Okay. Now this action potential will then propagate down the nerve. It has to travel, isn't it?
Yes, ma'am.
Okay. Now when more pressure is applied, there will be more distortion. It's same, isn't it? That is, when more pressure is applied, there will be more disturbance at the nerve ending. Thus, there will be an increased rate of action potential formation. Okay.
Yes.
Now, this receptor potential is actually a local response. Okay. That is locally. That is where the pressure is applied or where the nerve ending is there. It is a locally. Now, it is a graded response. That is, it will be increased with the increase in the strength of stimulus.
Yes.
That is, if we increase the stimulus, then the action potential or produced will be increased. Okay. Similarly, it can also be summated. That is, a few of the receptors, they will join together to produce a higher effect. Okay.
Yes.
Okay. Now, next one is the adaptation of receptors.
Yes, ma'am.
Okay. Now, now we have seen that when a distortion occurs, the receptors will start producing a membrane potential. Okay. Now, if that stimulus is going on, but still the receptors is not creating a membrane potential, then we say that we have already adapted to that stimulus. Okay.
Yes, ma'am.
That is known as actually the adaptation of receptors. That is, some receptors, they show a gradual decrease in the response even if the stimulus is continued. Usually if the stimulus is continued, it has to be continued, isn't it?
Yes,
But
ma'am.
here, in case of certain receptors, there will be a decrease in the response even if the stimulus is continued. This property of receptors is called as adaptation.
Yes, ma'am.
Okay, last class we already seen slow adaptation and fast
Rapid.
adaptation or rapid adaptation. Okay, good. So here, this is how the adaptation is taking place. Okay, now it actually here what is happening is that it will lead to a decrease in the number of impulses or the action potential. Actually, it has to increase, but here the reverse is taking place. It is leading to a decrease in the number of impulses. So
Yes, ma'am.
first, when you touch or give a pressure, there will be impulse formation. But when you go on touching, there will be no impulses produced. We don't feel any change. Okay. So this decrease in the impulses in the sensory nerve, even when the stimulus is continued on the receptor,
Receptor.
it means that the receptor is already adapted to that stimuli. Okay. Now this mechanism of adaptation is always different in different receptors. It is not always the same.
Yes, ma'am.
Okay. Okay. Now adaptation also we are studying with Pacinian corpuscle. Okay. Here a pressure is applied. It is transmitted to the nerve ending, which is then distorted, and the generator potential is produced. Same thing. Okay. But in the next movement, the pressure points, they are getting depressed.
Yes, ma'am.
Okay, then the pressure is accommodated. So
Yes.
the pressure is no longer transmitted to the nerve endings. Okay, at first they will transmit, and when further on the pressure is given, there will be no transmission through these nerve endings. Okay. Now, as the distortion is no longer present, generator potential is not formed. The Pacinian corpuscles are rapidly adapting mechanoreceptors found in the subcutaneous tissues, joint capsules, etc. Usually is found in the cutaneous tissues. Okay. Hello.
Yes, ma'am.
Okay. Then some receptors, they adapt slowly and they are called as a slowly adapting receptors. Okay. Now, some receptors are there which will never adapt to the stimulus.
Yes.
Okay, those receptors, the best example for those receptors are the pain receptors.
Yes, ma'am.
Why is it so? Because pain is actually a damaging stimulus, and the organism should never adapt to that receptor, that stimuli.
Yes, ma'am.
Okay, okay.
Hello.
Hello.
Yes, ma'am.
So with that, we are coming to the properties of receptors.
Yes, ma'am.
Okay, I hope you have understood that, isn't it?
Yes, ma'am.
That is slowly adapting and never adapting receptors. Okay, you can think that if the pain is getting adapted, what will happen? Our body parts will get damaged. Still, we won't respond, isn't it?
Yes, ma'am.
Okay. Now, next is about the properties of receptors. The main properties of receptors are, first one is adequate stimulus, then specificity, intensity discrimination, law of projection, doctrine of specific nerve energies, and receptor potential. These are the properties of receptors. Okay.
Yes, ma'am.
First one is adequate stimulus. That is, here the receptor is most sensitive to a particular type of stimulus, which is called the adequate stimulus of that receptor. I repeat, always a particular receptor will be more sensitive to a particular type of stimulus. Okay, like the lock and key mechanism of the enzyme. it will be mainly sensitive to that stimulus, which is called the adequate stimulus of that receptor.
Yes, ma'am.
Okay, but in the case of certain cases, certain other stimuli can also cause a change in this nerve endings. Okay, best example is that in the rods and cones, they are more sensitive to light,
Yes,
but
ma'am.
even a pressure on the eyeball can stimulate them. But pressure is not the adequate stimulus.
Yes,
Do you
ma'am.
get me? That is, for every receptors, there is a particular type of stimulus, which is known as the adequate stimulus. Actually, that is the proper stimulus for that receptor. But they can also be activated by certain other stimulus.
Yes, ma'am.
But it doesn't mean that that is the adequate stimulus.
Mm.
Like that, in certain locks, you can see it will be opening both with its own key as well as with certain other keys.
Yes, ma'am.
Okay, so the normal key, that is actually the adequate stimulus of that lock. Do you
Yes,
get me? Something similar to that. Okay.
Mm.
Okay. Now, the specificity. Specificity means the receptors are specific in action. A particular class of receptors will respond to only a particular type of stimulus. But there are also exceptions are there, but usually they are very highly specific. That is, they will respond only to their type of stimulus. Example for that is the free nerve endings in the cornea. It can be stimulated by different types of stimulus like touch, pain, temperature, etc.
Yes,
Do
ma'am.
you get me? Okay. Next is intensity discrimination. That is, intensity or the strength of a stimulus is interpreted by the receptors concerned. That is, the receptors can interpret whether it is strong or weak. All these can be interpreted by the receptors. That is, intensity of a stimulus is interpreted by the receptors. That is another property of receptor. That is, intensity is reported. How can it be reported? It can be only reported with the help of, that is, electrical impulse or the frequency of the action potentials. Okay, so here the frequency of the action potential produced by the receptors and also by the number of receptors stimulated. Okay, in certain stimulus can stimulate only a few number of receptors, whereas certain stimulus, they are strong enough to stimulate a large number of receptors. In that case, the frequency or the strength or the intensity of the stimulus will be more. Okay.
Yes, ma'am.
Now the next one is the law of projection. Here, if any part of the sensory pathway, you know that from the stimulus, there is a nerve pathway which is connecting to the central nervous system, isn't it?
Yes.
So, if any of these pathway is stimulated, usually the receptors are stimulated, isn't it?
Yes, ma'am.
So, instead of the receptors, anywhere in the pathway is stimulated.
Yes, ma'am.
Then the conscious sensation is felt at the site of receptor. The sensation will be felt only at the site of receptor. This is called the projection of that sense.
Yes, ma'am.
Okay, whether in the pathway, wherever it is getting stimulated, the conscious sensation will be feeling only at the receptor part.
Yes, ma'am.
Okay, this occurs even if the receptors are removed.
Yes, ma'am.
Okay, the best example is the case of phantom limb phenomena. That is, if due to any reason, if a limb is getting amputated, okay,
Yes,
the
ma'am.
receptors that is seen at the tips, that would have been lost, isn't it, along with the limb?
Yes,
Okay,
ma'am.
but still the nerve endings will be there at the amputated part, isn't it?
Yes,
So,
ma'am.
if that ends of the nerves are stimulated, the person will feel the sensation will feel that the sensation is arising from that non-existing limb,
Okay.
right? That
Yes,
is the original site of the receptor.
Yes, ma'am.
Okay, so that is that you can see is that certain people, they won't be having the full legs. Okay, their limb will be amputated, but still you can see that they will be that is, if some flies or mosquitoes, as if it is sitting there, they will be just doing it with the hands.
Yes, ma'am.
Okay, actually that is because of this phenomena. Actually, the fly or the mosquito will be sitting on that amputated part. Okay,
Yes, ma'am.
they will feel that it is sitting on their lost limb.
Okay.
Okay, that is known as phantom limb phenomena.
Yes, ma'am.
In the normal case, you can't stimulate the Neuro pathway, isn't it?
Yes,
In
ma'am.
a normal case, you can't. Only here we can say that in the amputated part, or else it should be in some operation or surgeries. Okay,
Yes.
but in the normal case, it can be well observed in a limb amputation cases.
Yes, ma'am.
Okay. Next one is the doctrine of specific nerve energies. That is, there is a specific pathway from each receptor to the cerebral cortex for the conscious sensation.
Yes.
If the pathway is stimulated anywhere and by any means, the sensation felt in the cortex is always to which the receptors are meant for. That is, you know that it is always connected, that is a receptor to the cerebral cortex is connected with the nerve pathway, isn't it?
Yes,
So
ma'am.
if in the last case also we have seen that is phantom limb phenomenon, also we have seen that whenever there is a stimulation in that nerve pathway, they will feel that the stimulus is coming from is at the receptor part, isn't
Yes,
it? Similarly, if the anywhere of that nerve is stimulated, the sensation will be the which nerve is stimulated. That sensation, that is actually that nerve is meant for what sensation it is taking. The same sensation will be felt. Do you get me? That is, for each and every receptor, there is a particular nerve that is connecting the receptor to the cerebral cortex.
Yes, ma'am.
So, if any of that region is stimulated, that is in between this region, anywhere it is stimulated, the same stimulation will be felt. That is, in your amputated limb, you will have lots of nerve endings, isn't it? So,
Yes, ma'am.
if the nerve ending of a touch is stimulated, that person will feel only the touch feeling.
Okay.
That's based on that nerve ending, because here it is actually amputated. There is no receptors, isn't it? So based on which area that fly is sitting or the mosquito is sitting, based on that the person will feel. That is, it is a pressure one or a pain one or a whatever may be. Okay, based on the receptor actually it was connected.
Yes, ma'am.
Okay. Now, in every pathway, the sensation felt depends on the type of the specific receptor.
Yes, ma'am.
Okay. Now, last property is the receptor potential. Is another property of the receptor. Okay. And this property is very much essential for the impulse or the information to pass on to the central nervous system. Okay.
Yes, ma'am.
Okay. Now with this, we have completed the receptor part. Okay.
Yes.
Now we have to see the three parts are there, isn't it? Now the receptor is over. Now the neural pathway.
Yes, ma'am.
That is, they have to carry the information to the spinal cord and to the brain. Now we are going to see the spinal cord region. Okay, the information is next on passing from the receptors. The information is going to the spinal cord first, isn't it?
Yes, ma'am.
Okay, so now we will see the spinal cord.
Yes.
That is, the sensory nerves, they send the information such as touch, temperature and pain to the brain and spinal cord. Then what will happen? They will give information. Then the motor nerves, they will send signals from the brain back to the muscles, causing them to contract either voluntarily or reflexively.
Yes, ma'am.
Okay. Reflex means that is if it will be it is a pain one, or if it is hot, then it will be a reflex action.
Yeah,
Okay.
removing of hand. Yes, ma'am.
Okay.
Yes, ma'am.
Now we'll see the spinal cord. Now spinal cord is actually a long, thin, tubular bundle of nerves. Actually it is a bundle of nerves, and they support the cells that extends from the brain.
Yes, ma'am.
Okay. Now the brain and the spinal cord, they together forms the central nervous system.
Yes, ma'am.
Okay. Now the main pathway for information connecting the brain and the peripheral nervous system.
Yes.
Okay, they are the main pathway, because from the receptor to the brain, it has to pass through our spinal cord.
Yes, ma'am.
Now you can see the brain and the spinal cord is attached to the brain. Okay.
Yes, ma'am.
Hope you understood.
Yes, ma'am.
Okay. Now next is the protective structure. That is the spinal cord. It has to be protected, isn't it? Because it is very important. Only then the information from the periphery or from the different parts of our body can reach the central nervous system, and the central nervous system, which is supposed to control the whole function of our body, it has to give information. So that information is sent also with the help of the spinal cord. So the spinal cord is very, very important. So this spinal cord has to be protected. And the protective structures of the spinal cord, they are mainly, as you all know, it is the vertebrae. That is a vertebrae will be there. Then there will be adipose tissues, then the spinal meninges and the cerebrospinal fluid.
Yes.
These are the ones which helps in the protective function of the spinal cord.
Yes, ma'am.
Okay. You. Now, the primary function of the meninges or the layers of the spinal cord, that is the spinal cord is covered with a particular layer, isn't it? That is known as the meninges. Now, the function of this meninges and the central cerebrospinal fluid is to protect our central nervous system.
Yes.
Okay. Now, epidural space, that is a space that is found within the space between the vertebrae and the meninges.
Yes, ma'am.
Okay. Epidural space is the one between the vertebrae and the meninges. You know, the spinal cord is covered with the meninges, isn't it?
Yes.
So the space between the vertebrae and the meninges, that is known as the epidural space. Now, the importance of this epidural space is that it is the one that contains the roots of the spinal nerves, the blood supply, that is the veins, arteries, lymphatics, and the epidural fat.
Yes.
Okay, that is the importance of this epidural space. That is, it is through this, all these are conveyed.
Yes, ma'am.
Okay.
Yes, ma'am.
Now, the subdural space is actually situated between dura and the arachnoid matter, which contains the interstitial fluid.
Yes, ma'am.
Main three regions that we have to study is this. That is the first one is epidural space. Next one is the subdural space. And the last one is the subarachnoid space.
Yes, ma'am.
Okay. So the epidural space, it was between the vertebrae and the meninges.
Yes.
Okay. Now, next one is the subdural space. It is the one between the dura and the arachnoid matter, which contains the interstitial fluid.
Yes, ma'am.
You know that what is dura and arachnoid matter?
Yes, ma'am. Meninges of the...
That is the three layers of meninges.
Meninges. Yes, ma'am.
Okay. Which are the three layers of meninges?
Dura matter, arachnoid matter, pia matter.
Yes. That is pia matter, which is the innermost one. Then the arachnoid matter, this is the middle one. And the last one is the dura matter.
Dura matter.
Okay, so now it is very easy for you. What is the subdural space? It is a space between the
Dura
outer
matter.
meninges, that is outer meninges and the middle one.
Yes, ma'am.
Okay, that is the dura mater and the arachnoid matter, the space between them.
Yes, ma'am.
And it contains the interstitial fluid. Okay, that is the subdural space. Now, in the case of subarachnoid space, it is between the pia mater. Pia mater, that is the innermost layer of the meninges and the arachnoid matter.
Yes, ma'am.
Okay, and it contains the cerebrospinal fluid. The other one, it was having the interstitial fluid. Now here it is a cerebrospinal fluid. In the case of epidural space, it was having all the roots, the spinal nerves, the blood vessels,
Yes,
lymphs, as well as the fat. That is epidural fat. Okay.
yes, ma'am.
Now here you can see from this diagram, you can see where that is the outermost layer, that is the dura mater, and next layer, that is a subdural. That is between the arachnoid matter. You can see the subdural space, and then between the arachnoid space and the pia mater, you can see the subarachnoid space. Can you see?
Yes, ma'am.
Okay. Now here also you can see another diagram, another section of the diagram. Here it is very much clear. That is the special spinal meninges. It consists of the 3 layers. That is a pia mater, the innermost, arachnoid, that's the middle one, and the dura mater is the outer one. Here in the other side, you can see the subdural space. That is between the dura mater and the arachnoid matter. Next one is a subarachnoid space, that is between the arachnoid matter and the pia mater. Okay, then you can see the spinal nerves. That is known as the roots actually. Here it is, what we are seeing is the roots. Okay, roots of the nerves.
Yes, ma'am.
Now here, this is the another section. Here also you can see how it will be in this section. Okay, that is a disc and the nucleus. That now it's not important. Now you just see where the meninges, vertebrae, the meninges, the epidural space and the spinal canal.
Yes, ma'am.
Okay. Now, in this spinal cord, in the adults, it extends from the medulla oblongata.
Yes, ma'am.
That is, where is the medulla oblongata is situated in the inferior part of the brain.
Yes, ma'am.
So, from the inferior part of the brain to the superior border of the second lumbar vertebrae. Okay, that is the case of the adults. Now, in the case of newborns, it extends to the third or the fourth lumbar vertebrae.
Yes,
that is the only difference. Okay.
Yes, ma'am.
Now, the length of the spinal cord is about 42 to 45 centimeters and 2 centimeters in diameter. And this 2 centimeters diameter, that is the normal one, it is mainly seen in the mid-thoracic region. You can see the 2 centimeter as such in the mid-thoracic region. But there is slight difference in certain regions. That is, it will be more than 2 centimeters or larger in the lower cervical as well as in the mid-lumbar regions.
Okay.
That is, the diameter of the spinal cord is not uniform throughout. That is what. Okay. Usually we can say that it is 2 centimeter in diameter, but there is slight variations can be seen. And these variations in certain regions, such as in the mid-thoracic region and in the lower cervical region, you can see it as slightly larger than 2 centimeters. And in the smallest, that is at the inferior tip, that is the last portion of the spinal cord, there will be a slight decrease in the diameter of the spinal cord.
Yes, ma'am.
Okay. Now as such, but if you say the diameter, it is 2 centimeter.
Yes, ma'am.
Okay. Now here also you can see the medulla oblongata, that is the inferior part of the brain, and from there the spinal cord is arising.
Yes, ma'am.
Okay. The other part is not important as per now. Okay.
Yes.
Now next one is the spinal nerves. Now the spinal nerves, there you know that they are the parts that is communicating between the spinal cord and the nerves that is supplying specific regions of the body. That
Yes.
is, from every region of the body, the information has to be taken and the information has to be given, isn't it? So
Yes,
that
ma'am.
communication from the different parts to the spinal cord, that is known as the spinal nerves.
Yes, ma'am.
Okay.
Yes, ma'am.
Now, here there are about 31 pairs of spinal nerves that emerge at the regular interval from the intervertebral foramina.
Yes, ma'am.
All these intervertebral foramina, all you would have studied in the anatomy, isn't it?
Yes, ma'am.
So, these 31 pairs of spinal nerves, they will be arising from the intervertebral foramina, and they are classified as 8 pairs of cervical nerves, 12 pairs of thoracic nerves, 5 pairs of lumbar nerves, 5 pairs of sacral nerves, and 1 pairs of coccygeal nerves.
Yes,
Okay.
ma'am.
Have you studied this already?
Yes, ma'am. The little bit. We know.
Okay. So this you have to by heart. Okay.
Yes,
All
ma'am.
these part is usually to by heart, nothing to understand here. Okay.
Yes.